Jesselina Espinar, you can come on back with me now. I'll take that from you.
Should I sit on a table or?
Wherever you feel most comfortable. Well, I am going to go ahead and take your vitals and then we can discuss some options. Can I have your arm, please?
Are you gonna take blood?
Right now, we're doing blood pressure, so no needles. But if you want an STI test, I'll draw blood later. Would you like us to screen for sexually transmitted infections?
Like, I don't think I have an STI. I mean, I've never had any symptoms or anything, so probably not.
Have you had any exposures recently?
No, I don't think so.
Got it. So just a routine testing for peace of mind.
I don't know. Should I?
Well, that's your choice. Have you had any sexual partners in the past 12 months?
Yeah, one. But that was just over the summer. And I think I'm gonna have a new one soon, so that's kind of why I'm here for the birth control.
Okay, well, that's still your choice. Plus, it never hurts to get tested, especially if you've never done it before.
Is it expensive?
Since you are 17, you'll be at the low end of our sliding scale. You shouldn't have to pay for anything.
Okay, I'll do it, just to be safe.
Okay, well, I am going to ask you some questions to make sure that we are doing the right kinds of tests.
There's more than one?
Yeah, we test in a different couple of ways depending on what we're screening for. For example, if you want to do a standard panel, we would test for chlamydia, gonorrhea, HIV, and syphilis. We would collect a urine sample or swabs and blood work. Does that sound okay to you?
Mhm.
So the questions I ask might feel a little bit uncomfortable, but that's just how we make sure that we are doing the test the best way possible.
Okay.
Do you have any history of STIs?
No, never.
And do your partners have a penis, vagina, or both?
Penis.
And what types of sex do you have? Vaginal, oral, anal, receptive?
Vaginal and oral?
And do you use condoms sometimes, always, or never?
Sometimes.
Okay, perfect. Well, I am going to draw some blood and I'll give you a swab that you can do yourself in the bathroom.
What's the swab?
Um, is this Q-tip looking thing? Like, have you ever gotten a COVID test done?
Yeah, lots of times.
Well, it's like that. You do the swab on your vagina on your own. I'll do the throat swab and blood work. Then you can leave your sample in the metal cabinet in the bathroom. Come back here, have a seat, and a provider will be with you shortly to discuss your birth control options.
Will I know right away, like, if I have something?
It takes 7 to 10 days to get your result, but we would only call you if there is a positive test result.
And then what happens?
Like once you get the test results back?
Yeah.
Well, that depends. Some STIs require antibiotics and it's done. Others might require a shot or continue treatment, but we will go over that with you once we get your test results back.
Would I have to tell people, like, the person I had sex with, even if we don't talk anymore?
Well, some STIs require contact tracing, like for COVID in the beginning, but that doesn't have to be you. You'd be able to use an app, or someone from the Department of Health would do it for you.
Would they give my name?
No, they wouldn't have to do that. And I promise you, you won't have to get in touch with someone you don't want. Now, let's get to why you are here today. I'll collect some blood to test for syphilis and HIV, and then we can discuss your birth control options. How does that sound?
Sounds good.
Perfect.